Hello everyone and welcome to AceOSCE's video for today. Today I'm going to be explaining the answer to the question that I posted. Again, it was not a basic calculation or a pharmacology based question, which is why I got again a lot of differing answers. Whenever I see this, I realize that this is a topic that most people either are not aware about, or maybe a little bit extra information will help all of you go in the long run. So I just wanted to make a quick video exploring all the options and why the right answer was the right answer for everybody who's tried to answer this question. Here's the question that I posted today. It said, the administration of which of the following dosage forms may not be best suited for someone having an acute asthma attack? Now, there are two things to be understood in this question. First is the word not, so you have to keep that in mind. And the second is an acute asthma attack. So this isn't about a patient who has asthma, maybe controlled, maybe uncontrolled. It is a specific situation in which a patient either has an exacerbation of their pre-existing asthma or has an acute asthma attack itself. Now, two things are really important to be understood in this situation. Whenever a person is having an acute asthma attack, they are not able to breathe properly anyway. So you definitely want to give them, number one, a medication that shows an effect right away so that they're able to breathe, and therefore survival is the most important motive. And number two, give them a medication that isn't very hard for them to use. So something that just gives an effect without any effort from the patient themselves. Number one option was meter dose inhaler. These are the inhalers that usually have some sort of a propellant so that helps the medication go from the oral cavity to the lungs with the help of the propellant itself. Number two, or option B, was the nebulizer, which is a device which helps the patient to breathe from their nose as well as the mouth. That helps the medication to go into the mouth or the body of the patient through both the routes, therefore shows an easier administration as well as shorter duration of action. So that is a good idea as well. Option D was oral corticosteroids. So corticosteroids like prednisone are actually very good for patients for having inflammatory asthma attacks. Therefore, the right answer in this case was option C, a discus. Now, usually I wanted to kind of share this with you guys. What is the difference between a discus and an inhaler? A discus, usually for example the Advair discus, is a dry powder inhaler, unlike an MDI, which is a meter dose inhaler, which pushes the medications into your lungs. In a discus, you have to breathe in quickly and deeply hold your breath in order for the DPI to release the medication into your lungs. Now, because this is a dry powder dosage form, the person needs to actually breathe in with some sort of force so that this powder goes from their oral cavity into the lungs instead of a propellant helping this process happen. Now, when a person is having an acute asthma attack, they're not able to breathe. You cannot expect such a person to actually coordinate their breathing and have some sort of force to inhale this sort of powder in. I wanted to show you what this discus looks like. It looks like a hamburger sort of device which has a dry powder. Unlike the meter dose inhaler, you do not want to shake it before you use it because you may lose the dose or you may lose the drug, as it is a dry powder if you turn it upside down. In order to use it, you usually open the discus, slide the lever, you breathe out, you seal the lips on the mouthpiece, you breathe in quickly and deeply. Of course, if it's a corticosteroid, you want to rinse your mouth after, but you need to use considerably more force in this sort of medication form than an MDI because it has no actual propellant to push the drug from your mouth to the lungs. And as you all know, when a person is having asthma attack, they cannot actually breathe in at all, much less breathe in a medication. I hope this answer clarified for all of you what the right answer was and why this was the right answer. Again, good effort from all of you who ever tried. Always keep trying out new answers, and I will be posting new questions. Stay tuned and all the best.